doctor.
Cipla will make it better. With a myriad of possible causes, most people are likely to experience heartburn at some point. Though it's generally mild and momentary in most people, others suffer with it chronically.
Heartburn is only a symptom of reflux of the gastric content into the esophagus. So, heartburn mainly affects people's quality of life. However, it can have serious consequences, for instance, narrowing of the esophagus, and then even in severe conditions, replacement of the esophagus. And then the most severe complication of heartburn is cancer of the esophagus, and often can be confused for presenting as a heart condition.
I've struggled with heartburn for many years, more severe in years past. And at some point in my life, I started making lifestyle changes to manage it, because I realized I can't get into the cycle of taking medication every day for heartburn. And then I suffered an episode of severe heartburn. At that point in time, I was under the impression I suffered a heart attack. It was a severe burning sensation. It's like a cramp in your upper chest. That really had me worried.
In terms of food, usually your fatty foods and your fast foods that are the main triggers. For instance, dry food is a huge problem. Bread is a main culprit. Chocolate, coffee, alcohol, all the things people enjoy the most are probably the main suspects.
Well, I hope to get some answers today to put my mind at ease. We're sitting with a family history of heart conditions, and I want to rule that out.
So when we do a gastroscopy, enter the scope through the mouth and then past the larynx or the vocal cords and then down into the esophagus. Then going down to the lower esophageal area where we see the most abnormalities with people with heartburn, and then also having a good look at the whole stomach, because ulcers and cancer of the stomach and the esophagus in this area can cause similar symptoms.
The endoscopic camera is inserted under mild sedation. The procedure reliably assists in diagnosing and treating the underlying problems.
There we are on the stomach. Okay, what we see here is a large hiatus hernia. Normally the stomach should sit tight around the scope, but we can see there's quite a big gap between the scope and entry into the stomach. And this implies a hiatus hernia, which we know is associated with reflux disease. So in his case, we confirmed that gastroesophageal reflux is responsible for his heartburn, and importantly excluded other causes, for instance cancer, which can also simulate heartburn. We found a hiatal hernia as well, which is something that contributes to heartburn, and furthermore he's got a small erosive ulcer where the esophagus goes into the stomach.
I'm feeling a bit groggy, but I'm elated. It seemed to be not a heart problem, and actually hiatic hernia, something I didn't know.
The majority of patients with heartburn are controlled with simple medication, the simple antacids. However, if the symptoms persist or there are any danger symptoms, for instance, difficulty in swallowing or coughing up of blood or vomiting of blood, then obviously you need to see a specialist.
And even if your symptoms don't fall into the danger zone, you should probably start by cutting out all those foods you shouldn't be eating anyway. Cipla will make it better.
Hello, doctor.